Hi there. I wanted to talk about a small little thing which is called how we use our language and how do we ask for what we want, you know. So every time that I work with a parent and I ask them, what are your goals for your child? What do you want me to help you with for your child? The kind of answers that they give me is, I don't want him to be distracted. I don't want him to put things in his mouth. I don't want him to run away here and there. I don't want him to do these finger movements. I don't want him to do I don't want him to be non compliant. I don't want him to have tantrums. I don't want him to have meltdowns. And I paused there. I asked the parents again, you know what I asked you? What is it that you want? That you want me to help you? I told you, I just told you that I don't want my child to do this. I don't. So I said, yeah, but I'm asking you, what is it that you want from me? And they said, am I not telling you what I'm wanting? And I tell them no, because most of the times when we talk to our therapists, we say, I don't want a particular behavior, which means my focus is on that. I don't want him to mouth. I'm thinking about mouthing. So if I don't want him to mouth, what do I want my child to do? I want him to be more regulated. I want him to be more focused. And what do I see him doing? What do I see my child doing? I don't want him to run around from one room to the other. I don't want him to move around in the class. So what do I see my child doing? I want to see my child sitting on the bench, listening to the teacher, taking out the book when the teacher asks to, put that book back, open his tiffin when it's tiffin time, eat, put it back, and do it all on his own. This is what I want. I hope, or I don't know if you sense a difference between both the things what I said. When I am able to focus, my word is focus. I'm going to repeat it so that it's very clear what I'm trying to tell you. What am I focusing on? I don't want this in my child, or I want this for my child. It seems like a small little thing what I'm sharing with you, but it has a huge, huge, huge impact. Believe me, it really has an impact. Because when I say I don't want this, I am magnifying, I'm amplifying the undesirable behaviors. When I say I want this, I am magnifying what I want, not just for the child, but for myself. Because what we think about our child in our head is what is something that matters a lot. It really matters a lot. So what I'm trying to tell you is, what do I want for my child? I want you to be able to visualize that instead of saying I don't want this, I don't want that. Think what you want for your child. Write it down. Get a book out, write it down. Or like what I just told you, speak it out. Put it onto your tape recorder, your recorder on your phone. Listen to it again and 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 again till it becomes your inner voice. And when some therapist or somebody or your own self asks you, what do I want? That statement is what plays into your head. It has an impact. It has an impact on you, your state. It has an impact on how regulated you feel when you have this kind of a conversation in your head, and your state affects the child. So it's a small thing, but I want you to focus on what you want. It really impacts. If you feel it helps you, do put it in the comment how you executed it and how it changed your life and your child's life magically. Take care.